and thank you for joining us in this edition of Golden Pages Medicare Show. We finally got back into the studio and we're bringing you more information on what to do when you turn 65 and you're newly eligible for Medicare. A lot of people out there, especially in our area, are turning 65 here within the next year. We have over 4,000 people just in our area alone turning 65 that are going to need some sort of guidance, and we're here to help. So if you're turning 65, are wondering what you need to do, it is that you need to set up, just give us a call at 1-800-253-6714 and we'll go ahead and lead the way for you. I know that sometimes it can be quite complicated. We get a lot of phone calls from people saying, hey, we don't understand what we need to do next, or we don't know what steps to take. You don't have to worry about it. If you call us at 1-800-253-6714, we can help you lead the way. And talking about that, I have here with me today one of our agents, Christopher Garza. Thank you very much for joining me here today.
Glad to be here.
I know that a lot of people out there have a lot of questions, and that's what our show is about. We want to answer their questions. We want to make them know that there's somebody here, an advocate for them, that is going to help them lead the way. And of course, today, with you being here as our special guest, I want to talk about other subjects as well, like life insurance and funeral planning, which is your expertise. So, but let's talk a little bit about Medicare, since a lot of the folks are used to hearing that topic on our show. I know that right now there's a lot of folks that are giving us a call, wanting to change, and they're on Medicare only. And right now they're locked in, so they're unfortunately have to wait till October to make that change, but with all the changes coming, they just don't know what to do, and it's quite confusing.
Yes, it's a complicated subject. Even agents like myself, we've been doing this for years. We're licensed, we're professionals, and at times we got to revert back to the book and say, hey, let me look at this again, because it is that complex. So I can imagine how the people out there turning 65 feel.
Well,
but that's
with
what
all
we're
the
here
changes,
for. Absolutely.
Just last year alone, we no longer have the open enrollment, which ran January to March 31st.
Yes.
And now instead of November 15th, we're having to start the enrollment on
October 15th to December 7th. So you don't have as long a time as you had in the past to make your decision. So
basically from October 15th to December 7th, that's when you have to make the change that becomes effective in January.
Correct. That's correct.
And a lot of folks out there are not aware that this change is coming into play, and it doesn't affect just people turning 65.
No, it doesn't. But I'm glad you pointed that out. That's something that's so important to Medicare beneficiaries, especially those that have been on Medicare for a while. They're so used to that time frame that they had to make a choice. Now, if they haven't been properly notified, some of those people like to wait to the end of the year to make that decision, and they're not going to have that opportunity this time around. So.
That's right. We had majority of the phone calls came in the last 2 weeks of the year, and so it's good, that the people out there know that October 15th to December 7th is what, and a lot of folks say, well, I'm already set. But what happens? Every year Medicare changes, and every year each company offers new benefits. So it's it's very important that they start thinking about it now. What do I have to do? And right now we are taking appointments even as early as it is right now, so that we can start seeing, because those fill up really quickly.
Definitely. We do free reviews, free sit-downs. We take pleasure in sitting down with people, helping them sort out their situation. Be proactive, people. Like Clarissa's saying, get ahead of the game. Just because your period of time is between October 15th and December 7th doesn't mean you can't start looking now and doing your research, and that's what we're here for.
True. And a lot of folks, they think that, I already have a prescription discount card or what have you. That not necessarily means that they have a Part D coverage. And if they don't have Part D coverage, then they get hit with the penalties when they do sign up. And so what we would like to offer folks is just call us in at 1-800-253-6714. They give us a phone call, run us through what happens right after they give us a phone call.
Well, what we'll typically do, CMS requires us to set up an appointment 48 hours from the time that we spoke to the person, unless, of course, they come into our office. Then we can sit down with them the same day. And, what we do is we cover, everybody's situation is different. There's not one Medicare beneficiary who has a like situation to the person.
Even husband, wives.
Definitely. Everybody's different. So it's very crucial that we sit down, analyze it from top to bottom, and try to find out what's best for that individual.
You know, because there's a lot of people out there that qualify for low-income subsidy, or they may qualify for Medicaid and they don't know it. Maybe they applied 5 years ago and got turned down. But what they need to know is that every year those Medicaid guidelines change.
Correct.
The low-income subsidy guidelines change. So, you know, we can help them reapply again, lead them through the system, because all that paperwork, you know as well as I know how much paperwork that is. And for a 90-year-old sitting at home trying to figure out how to fill out that paperwork, if they don't have help, it can be quite, you know, it's too much